Another thing we did here in Ohio was looking at home visiting across the state. So the state knew that if they could get more families engaged in their home visiting program, so this is when you have a new child, it's a voluntary program, you can have access to a nurse or a childhood specialist to come into your home and help you and answer any questions, because let's face it, we don't get a guidebook when we bring a baby home. And so this is the goal of this is to reduce infant mortality, to improve mental health of mothers, just make sure that the earliest of children are meeting their developmental milestones, and if they see any concerns, they're linked to the proper resources. So obviously we can't change people's lives if we don't engage them into our work. And so we, through the power of data collection, we're able to track who were the home visitors serving, what were they doing, like how many visits were families engaging into the work, as well as how well they were doing it. Looking at things like what time of day were the home visitors available to come to the family's house, as well as this feeling of helpfulness and cultural competency. And what we learned was that if the family perceived that the home visitor was a helping person versus a, kind of that big brother or a paternal telling them what to do, but instead more of a resource and a guide and a coach, that family was more likely to engage, therefore better childhood outcomes. And we also learned the hours of the day mattered. So if you had a traditional 9 to 5 or no weekends, they were less likely to engage. So again, it's making sure that you can relate your, what you did to outcomes data that will really drive your story and help you raise more money.